Dr. Rachana Kulkarni, thank you so much for being with us on ITV Gold. I appreciate you for bringing in a lot on COVID-19 updates, impact, and measures. Hope you're doing well.
Thank you, Aditi. It's good to be here.
Of course, we have you again here on ITV Gold, so I want to go right into the questions. We have so much to discuss. There's so much happening in the nation with COVID-19 that let's get right into it. My first question has to be the biggest question that's being asked around the entire nation. Did we as a nation open too fast? There are states that are surging in numbers that are unbelievable, and we are getting a little bit worried about what's happening in the South and West. So how are you looking at this entire situation right now?
So, Aditi, it's the numbers speak for themselves, right? You have seen where we were when we had our last conversation, where we were in New York and New Jersey, and the numbers were soaring. And then we did the right thing, and the right thing being wearing masks, social distancing, and staying home whenever we can, and not opening too fast. All those precautions and all those measures have paid their dividends, and New York, New Jersey rates for COVID are much, much less. Now, think about how things are where these precautions were not followed,
Right.
because the message in the country is not consistent. So, where we opened up too fast, where uh, wearing a mask when you step outside is not mandatory, where bars and other businesses and restaurants, etc., were open, you have seen a very alarming rate of surge in all those states. So I think the numbers speak for themselves.
Yes, and looking at the fact that this is just the first wave still of COVID-19, there's prediction of a second wave which is going to hit the country perhaps in fall. Do you believe or do you think that the second wave could be triggered by this ongoing first wave in the South and West?
The the virus has its own timeline and its own mutation. And let's not forget that when the second wave is predicted, that's when traditionally the flu season is, which itself is a huge cause of mortality and morbidity in
Yeah.
the US. So think about that the symptoms are fairly similar, and you won't know when the patient has flu or COVID. It is going to be, in my opinion, it's not going to be whether we will have a second wave or not. I think there will be a second wave. Question is, how bad will it be?
As a medical professional, and I know you are a very reputed cardiologist, so you're also communicating with the entire medical community around you. What are some of the biggest concerns with these surges that you're seeing? Florida, Texas, Arizona, California, all are spiking with case numbers. What is the biggest concern out of all of this?
Um, two big concerns, Aditi, with this. One is that if the hospitals and if the ventilators are at capacity, um, physicians and family members will have to make some very difficult choices about the availability of ventilators, which is unfathomable to us in the United States, but we may face that choice. Um, so that's a big concern. Second is um, somehow our younger population has gotten the message that even if they get COVID, they are not going to die from it and they're going to come out okay. And that's probably one of the reasons why they are not social distancing, not refraining from going to bars, etc. However, let's not forget that the way the virus travels, you may not get anything. The young individual who is going to the bar may not get infection, but that can he or she can pass on that virus to a person, to their grandparents or their parents, their grandparents who might be immunocompromised, who may have high risk conditions such as diabetes, high blood pressure, heart conditions, or they can pass it on to even a younger individual who might be immunocompromised and they just didn't know that. So I think we, at this point, Aditi, we don't have any medicine for this, no preventive measures other than what we have in hand, which is hand hygiene,
Yeah.
social distancing, and wearing a mask. When we don't have anything else, when we don't have a vaccine, I think we should all take this seriously and do whatever we can.
Yeah, I want to talk to you about masks because this is something that's been discussed heavily in the last 2 weeks. Just yesterday, in New Jersey, the state you're coming from right now, the governor mandated a mask rule in public places where social distancing cannot be maintained. How important do you think it's going to be for us to have a universal masking mandate, perhaps where the entire nation is required to wear a mask if they are in public where social distancing cannot be maintained?
I think it's extremely important. And I think it's such a simple measure that can go such a long way. I don't see any reason not to do it at this point.
Yes, for sure. You know, looking at more of the COVID-19 cases, I'd like to now reflect on the drug trials as well as vaccination. Currently, the US government has awarded $1.6 billion to one of the leading pharmaceutical companies that is working on bringing 100 million doses of this vaccine by January. What is your prediction with this one company, and do you think it's feasible or effective to get a vaccine by that time period?
I would be cautiously optimistic about it, but we all know in medical field and even otherwise also, the problems come when the rubber meets the road. So, and we at this point we don't know enough about the virus. I don't think that we know what kind of immunity will the vaccine provide. In addition, let's not forget that these viruses tend to mutate. So I'm hopeful, but I'm cautiously optimistic.
And what are your comments here on remdesivir? Because that's one drug that we are hearing about a lot nationally and internationally. How are you looking at that one medication?
That's the only medication at this point that has been shown in clinical trials to be effective. But let's see what it does. What it does, Aditi, at this point is that it just cuts down the days of hospitalization. So that is what the clinical trials have shown. It does not prevent COVID. It just cuts down the acuity of the disease.
What do you think is the best way to protect ourselves?
Masks, hand washing, social distancing. Be smart.
Yes, for sure. You know, I want to take this part of the interview and reflect on at high-risk patients because last time also when we had you here, we reflected upon the impact on, you know, a cardiac interaction with COVID or just high-risk patients and COVID-19. Could you give us what are some of the recent developments in these interactions between high-risk patients that have heart diseases or cholesterol or diabetes? How has COVID been impacting that? And what has your personal experience been with your patients in that case?
Certainly. I think you bring up a very important issue because, as we know, high blood pressure, heart disease, diabetes are some of the high risk category patients if for COVID. And because we were all concerned about it as a nation, what we have noted is that people were afraid to go to the hospitals. And our nationwide experience is that calls for 911, if a patient is having a heart attack or a patient is having a stroke, they were so afraid to go to the hospitals that number of patients that were brought to the emergency room or number of 911 calls for chest discomfort or stroke-like symptoms went down by 30 to 40% during the month of April and May. Wow. And as a result of that, unfortunately, we are seeing a lot more out-of-hospital cardiac arrests, which is terrible because people are in doubt whether or not they should go to the hospital.
Yeah.
And
Yeah.
my appeal to our viewers is that please don't die of doubt.
Mm.
And that's the American Heart Association's appeal to everyone, that please don't die of doubt. If you're in doubt, if you're having a heart attack, if you're in doubt
Yeah.
that if you're having a stroke, please call 911. The hospitals are now a safe place to go. They have all the precautions, they're taking all the precautions and have protocols in place so that they appropriate COVID free care can be
Mm.
delivered
How,
to the patients.
how much of
So take
that?
care of the heart.
Yeah, for sure. And how much of this is impacting the South Asian diaspora, according to you? I know you have a lot of South Asian patients. You're in a very heavy South Asian state. But how much of the community is getting impacted by this?
A lot, because South Asian community unfortunately leads um, in the Department of Cardiovascular Disease, because we are um, a population that has high incidence and prevalence of diabetes, high blood pressure, high cholesterol, and heart disease. So with that and with our doubts, South Asian community has been impacted a lot. Um, and unfortunately, we are seeing the downstream effects of that in the hospital. Like, I have seen people who showed up to the hospital 3 days after having their heart attack.
Oh, wow.
And why is that important? It is because by that time, the damage is irreparable. When that part of the heart muscle dies, it cannot be rejuvenated. Angioplasties don't work at that time, so the scarring on the heart becomes permanent. And I'm seeing that across the board from 50-year-olds to 80-year-olds.
Wow.
It's very sad to see 50-year-olds dying of out of hospital cardiac arrest
Yeah.
just because they chose to wait and not call.
Wow, it's so important for these people to reach out and get help, and I really hope they took some of your advice here. Just discussing a little bit more on COVID-19, I just wanted to know your take on testing, both for COVID and antibody testing. Where are we in the state of New Jersey or New York with it, and how important do you think testing could be in the other states that are surging with cases, and do you think they have enough testing over there?
I think we have done a very good job at testing in New York and New Jersey.
Right.
There, initially we had our own challenges, but at this point, testing is available. So if you have any doubt, please get yourself tested. Antibody testing is also now available on a commercial basis. So it's very easy to get yourself tested. But let's not forget that if you are tested negative for COVID, that does not give us a license
Yeah.
to go out and not to practice the measures, because that status, the negative status, can change into positive within a matter of a day. Also, at this point, there are certain reservations to find out whether how long the antibody immunity will last. So I do believe we should get tested. It's available, but at the same time, not to drop our guard regardless of the test results.
My one question to you here would be, what, according to you, since we were the epicenter ones, the state of New York and the state of New Jersey where you're coming from, what lessons should these other states that are spiking in cases should learn from, the once an epicenter? What do you think they need to do right away? And is shutting down a possibility?
I think we need strong, consistent messaging from the leadership in the state, and we have to look at what is right for the communities in that state, what is right for the population in the state. And that means we have to learn from New York and New Jersey, who got impacted heavily but did the right thing by shutting down, by social distancing, by taking all the appropriate precautions. I think that's very important for the other states to do.
Yes, for sure. Another popular question that I wanted to ask you here, we're getting a lot from the audience, is do you believe schools should be opening up in the fall? There are many states, even the states that are showing peak of cases, who have announced that they want to open schools K to 12 in fall. How are you looking at this, and do you think that's a smart decision?
That's a tough question for me to answer, Aditi, but from what I'm seeing now, from this vantage point,
Yeah.
I would definitely listen to the experts in the field, such as Dr. Fauci,
Yeah.
who has expressed his own reservations about opening the schools, because I just can't see if this trend continues. Like for the last month, we were doing very well and everything was trending down. And now you're seeing more than 60,000 cases in a day. I just can't envision how we can have so many kids in the school sharing a space um, in a classroom. Uh, that's that's my concern,
Yeah.
and I would say I would listen to science. I would listen to the experts such as Dr. Fauci and Dr. Burks.
For sure, listening to science. I think that's the key right there. Listen to science, and we will get our answers. Dr. Kulkarni, I truly appreciate you here for your time. I would love for you to give one last message to our audience.
At this point, for COVID-19, we don't have a preventive treatment. We don't have a vaccine. So, in absence of that, what we can do is all in our hands. What we have in our hands is hand hygiene, uh, wearing masks, and social distancing. We can partially control our destiny. So, till science comes to rescue us, let's do what we can.